practice. She has the 360-degree perspective of medicine. She has extensive experience in hospital medicine, post-acute care in rehabilitation, nursing home, and memory care, which is such a big deal these days. So we thank you for your work, Dr. Van Horn. She is integrated in the multidisciplinary team approach as a medical officer in psychiatric care. She is a medical director for home health and aesthetic medicine in the medical spa experience. And in short, she understands the complete patient. This is what Dr. Van Horn brings to the table in your healthcare in a caring and thorough manner that, ladies, we deserve. So please help me welcome. You can use your reactions and your emojis if you wish on the chat, whatever you do, whatever you feel comfortable doing. Please help me welcome Dr. Simone Van Horn.
Hello, everyone. I'm Dr. Van Horn, and as Stacy says, my relationship with her goes all the way back to high school. And we happened upon this subject, yes, because she was in the hospital, but in addition to her not knowing, I thought it was really important because when I started my perimenopause journey, I didn't know, and I was a doctor, right? And I had, even at that point, quite a bit of experience. And I must say, medical school and even my residency program didn't really highlight the issues surrounding perimenopause and menopause. And I figured what I do to kind of really highlight this and make this really stamp all of you who are in this room this evening is take you on the menopause journey that I had and the perimenopause journey that I didn't know that I was going through, and let you know how that affected me during my perimenopausal time, the aspects of my life that it affected. So it would really resonate with some of you guys who are struggling. And for those of the people who are on board who are my patients, right, that they know that there's no low that you can really tell me, because I've been there, right? And so thank you for introducing me in terms of my experience, but also in the prayer. And I'll start off myself with opening this discussion by saying James 5 verse 16, confess your faults one to another and pray for one another that ye may be healed. And so in essence, what I'm doing here is healing myself, because I'm going to be sharing a lot of things with you on my perimenopausal journey, and in teaching you, I'm also healing myself. All right, let's go. Next slide. So we're going to go on a journey back in time, right? And my perimenopause really began, if I really think about it, it happened really after I had my kids. But I did not realize it was happening because really no one had ever pointed it out to me, not my obstetrician. I mean, like I said, as a doctor, I don't really have a primary care physician. I really have colleagues who are taking care of me who don't really see me as a patient, right? Which is kind of the bad thing when you become a doctor, that sometimes we kind of have tunnel vision. But even so, I didn't know, right? And we're going to go back in time to help you see why so many of us get missed, right? Because I, as a physician, was probably blaring as a perimenopausal patient, right, that needed help, but it got missed, right? Let's go forward. So, next slide. So my journey really began at the University of Pennsylvania Health System. And a lot of you already have this health assessment chart, right? And this is really how I begin my discussion with my patients, because a lot of those things on the health assessment chart that you'll see here, some of you would have received this on in your emails, and some of you will have this from my Facebook page or my Instagram page. Really look at that and be very honest with yourself as to what things in this are severe and very severe. In women, what is actually very strange, and every time I see it, it's very telling to me that a lot of women just tick in all of them, none, all of them, nothing's wrong, right? And actually for me as a doctor, that's my biggest red flag, because I know that there's something wrong. But what happens to a lot of women and men as well, actually, is that they don't think anybody can do anything about the stuff that's there. Their irritability, their exhaustion, the joint pains, the cognitive things, waking up in the morning and having to have coffee by 3 o'clock in the afternoon. And if you don't have it, you're going to die. You can't think, you can't remember anything. You know, walking past beds and like wanting to jump into the bed, right? They think that this is just a product of age. It's a product of the people in their office are making them crazy. They're the ones who are annoying them. My wife is annoying me. My husband's annoying me. The kids are, you know, annoying, right? And really, those things may be true, but also what is true is these things are more pronounced because of the hormonal changes that are happening. Next slide. So here we are at University of Pennsylvania system, Pennsylvania Hospital. Pennsylvania Hospital was actually the first residency program in the United States. It was the first hospital in the United States, right? And it's the first place where surgery was done in the United States. They have like the amphitheaters where people used to come to watch surgery. You would drink some liquor before they did the incisions and cut you without any anesthesia. And it was an honor, really, and a pleasure to work there. And there we have my name's there. That was 2003 where I began as a resident. But they have residencies, students and interns going all the way back to like the 1800s. It's pretty fascinating. Let's go. Next slide. So while there, I became pregnant in my last year of residency, and I was considered an elderly prima gravida. Elderly prima gravida means that you are an old person having a baby. And for many of us in this generation, or Generation X, we're having babies older. Now, the other aspect of why menopause is so difficult and the perimenopause is so difficult for us is because our testosterone begins to decrease at age 25, because we are fearfully and wonderfully made, but we are also made for a purpose. And that purpose was really meant to, if you really look at the body, you are really meant to have babies earlier rather than later. By the time you get to about 34, 35, 36, your hormones are decreasing, but in particular, your testosterone levels are decreasing. And your testosterone levels are actually, somebody needs to mute. Your testosterone levels are actually exceedingly important to your vigor, your interest in sex, your ability to be interested and motivated, your ability to not have pain, to your ability to think clearly and cognitively be your best, right? So, you know, in my residency program, I was, as you heard, I was a chief resident. I was the youngest person who got whatever awards. I was on top of everything. I was very clear cognitively, right? After I had my baby, I realized that I was more anxious. I was more irritable. I lost a lot of zest for life. I was somebody who loved going out, doing lots of things. And I really blamed a lot of that stuff just on the more responsibilities that life was throwing on me, right? That I now had graduated and I now had to work like a real job and get things done. right? And really, as I'm watching more and more women, I'm seeing more and more of those women get, into perimenopause, and they're experiencing this. And they're wondering, why is it that it's so onerous? Like, why is it that it seems harder for them than it did for their mothers? Well, our mothers in general had babies earlier. Our mothers in general, when they had those babies and they went through the stress of having babies, their testosterone was able to bounce back to normal. Now, when you have a baby at 34, 35, 36, 37, 38, 39, 40, your testosterone is almost half of what it is when you're 25, right? So the stress of having a baby means that you're going to be up late at night. You're not going to be able to work and take care of the baby without it being like a huge deal. That may not be so much of a big deal when you're in your 20s, right? Yes, it's going to be hard, but it's much harder when you get older. Now, when your adrenaline levels and your cortisol levels are that elevated because of stress, what those do is it depresses testosterone. So we have a double whammy. We have testosterone, which is half of what it is, and then we have stress causing more adrenaline and cortisol, super depressing our testosterone. And in the 30s, I'm seeing more and more women with testosterone in the 20s and 30s, which is actually low, right? You feel your best with a testosterone of about 90. So let's go to the next slide. And it's what happens after we have kids, as I just alluded to, is that adrenaline goes up, cortisol goes up, and the cortisol, if it stays up too high, it mobilizes blood sugar, right? Because stress really would mean ancestrally, or even just 400 years ago, it would mean a wild beast is chasing you. There's famine, there's war, there's plague. You have to move quickly, move the tribe quickly. And what stress means now is, your alarm bell goes off at 4 o'clock in the morning and startles you out of bed. Stress is you're watching news and you're hearing about this war and that war and another war that's on the way. Stress is people being rude to you, when you go to buy something, or just making your life ridiculously hard for no reason, right? This is the world that we are now living in. And all of these things, we're in rush hour traffic and people are bad driving you and, whatever, not allowing you to go over into the lane for no reason, right? These things increase our adrenaline, increase our cortisol. Cortisol mobilizes the blood sugar, but it's not a wild beast anymore. You're just sitting down sedentary. And when that blood sugar goes up, increasingly what's going on is you're becoming more and more pre-diabetic and then diabetic, because the blood sugar is not in keeping with running away from a wild animal anymore. You're just sitting, getting irritated, right? The adrenaline that's pumped through our system causes constriction of our blood vessels, and that it causes increase of our blood pressure, right? And so now you begin to see right? What is kind of transpiring in our society with the increase in stress and things just kind of generally being out of order, right? And the order really that God created us to be in. The other thing that happens when we have babies is if you are too stressed out when you're having the babies, your sex hormone binding globulin increases. Sex hormone binding globulin is a protein that binds to your sex hormones, your testosterone, your estrogen, your progesterone. And what it does is it does not make it as available to the cells. Now, you have in your 30s, your estrogen and your progesterone are sky high, but your testosterone, like I just said, is quite low. So what happens is that although you do have some testosterone is really much lower because it's not available. It's bound to this protein. And nature produces this protein because it really is trying to preserve your energy for the kids that you do have. When you bind that testosterone, what happens is your sex drive goes down because your body is trying to preserve you from having more kids so that you can take care of the kids that you do have. That's really the nature's way, God's way of like kind of preserving you, right? Because your body is recognizing that you're exceedingly stressed out, and it tries to take that drive away, and just let you preserve yourself for the kids that you do have. So we have women increasingly with decreasing sex drive. The testosterone helps our muscle mass. The testosterone helps us to have zest for life. The other corollary to that is that we just start to feel older when we're in our 30s, much older than probably what our mothers felt like. All right, next slide. What then begins to happen is that our adrenal glands and our ovaries start producing less testosterone, as I mentioned. And this lack of testosterone, which is causing us less energy, more headaches, we're not interested in sex, we have more muscle joint aches and pains because testosterone is a potent anti-inflammatory. All those things are beginning to happen, right? And they begin to happen to women, and they think, oh, it's just because I had the babies and things got stretched out, and yeah, that's, I have more back pain since I had the baby. But really, it is, in addition to that, that your testosterone levels dropped dramatically after you had babies because it was so stressful. And when your testosterone drops that dramatically, you've lost your body's natural anti-inflammatory. And in addition to that, you have to take care of kids. I had one child, after my first child, who had lots of energy. I had boys, right? And you're running around behind these boys, and whatever energy you do have after you come home from work, you're using it to run behind your kids. Next slide. So let's talk about testosterone and the benefits, because that's really the perimenopausal hormone that's really decreasing and really giving us our symptoms. Testosterone helps you to sleep, right? Testosterone actually, people think that testosterone is a hormone that makes you like really angry and really butch and really whatever. But no, testosterone helps you to sleep, which is why in general, women can't sleep in their 30s, 40s, and definitely by their 50s. And men seem to be able to sleep no matter what, right? And women are like, you're just lazy, you have nothing to bother you, right? But it's not that, it's just that they have more testosterone, right? After a workout, you'll have very, very good recovery, right? Because testosterone helps us to produce collagen, right? So even if you have some muscle damage from a tendinitis, let's say, right? The more testosterone you have, the less that's going to get out of control, because testosterone, as I said, is a natural anti-inflammatory. By the time you get into your 40s, your risk of having joint pains and aches and damage, to especially like our athletes, you'll see what the 30-year-old athlete can do, the 40-year-old athlete can do. What a 20-year-old athlete can do is not what you can do after that. That's not just wear and tear. A lot of that is hormonal. As I said, the adrenaline and the cortisol that's happening increasingly in all of us, right? As we have to hear the news that's going on, have to go through all these wars, have to go through an increasing crime, have to go through people who are just, what the Bible called hard-hearted, right? People who just are mean and cruel for no reason. Those things raise our adrenaline and raise our cortisol. And when that happens, if your testosterone is low, there's nothing to meet that, right? Adrenaline is going to keep you up at night. Cortisol is going to make you more fat. The antithesis of that is testosterone, which gives you more muscle mass. It helps you to calm down, right? If your adrenaline levels get high, the testosterone meets it there and helps to calm down and get things back into perspective. The other thing that testosterone does that a lot of women don't realize is the reason why men don't get breast cancer the way we do is because they have more testosterone. So when our testosterone levels begin to decline, we also have more proliferation of breast tissue, and that breast tissue proliferation can get out of control. And that is what we are beginning to realize is actually what leads to our increase in breast cancer. So having a higher testosterone level for longer, right, actually decreases or risk of breast cancer. Testosterone and estrogen are both receptors that are on our bones and our muscles. And the testosterone receptors and the estrogen receptors actually more. It helps the bone to remodel because they form osteoclasts and osteoblasts, which are basically our building blocks of very strong bone. So as we start to lose these hormones, is where osteoporosis, or before you get to osteoporosis, osteopenia begins to creep in. And if these hormones and your vitamin D, etc., are not kept in proper balance, you find that by 60, you trip and you fall, and here you are having a fracture for no reason. You don't know why. Well, it's because your testosterone was falling since you were 25 years old and started to exponentially decline when you were in your 30s. The other benefit of testosterone, as I said, which is what people really associate testosterone with most of the time, is strong muscles, bulking up and stuff, because of the fact that it helps with muscle regeneration. But as we all know, people who have more muscle actually have higher metabolic rates, right? Testosterone actually is a receptor on most of our cells, and it helps with insulin to get into our cells. So the more testosterone you have is the less insulin resistant you are, which really means the less ability you're going to have to be a diabetic. Testosterone also helps to increase your good cholesterol and decrease your bad cholesterol, right? Sorry, that's a little typo there. It decreases the LDL and it increases your HDL, right? HDL is our good cholesterol, which binds up the plaque in our arteries and basically acts as a scavenger of bad cholesterol, and it dumps it in the liver, and then we pass it out in the stool. So testosterone, we're realizing, helps us in a cardiovascular manner. And actually, historically, in the 1940s and 50s, before we had things to dilate our blood vessels for heart attacks, they used to give testosterone, an injection, if you were having a heart attack. Let's go, next slide. So we couldn't get this to work, right? But this is the adrenal body type, right? And this is the body type that you tend to see as we get more menopausal. And we now recognize that a lot of this is adrenal fatigue. And for those of you who like to Google, you could Google that. And adrenal fatigue is really the increasing adrenaline and the increasing cortisol that we're seeing in our population now. And people keep saying that it doesn't exist, right? The experts say it doesn't exist. Well, the experts don't know what they're talking about, because it totally exists, because we're literally seeing people walking around looking like this, and we're seeing, if you do the blood work, the testosterone levels that are declining, right? So this is very much a phenomenon that's happening, and the experts don't know what they're talking about. Next slide.